hyperpigmentation, melasma, acne scars, wrinkles, age spots, sunspots, and more. Lasers, when used correctly, can be used to address a wide variety of skin issues and give you that porcelain glass skin we all want. But laser treatments in the wrong hands can lead to disastrous and potentially lifelong outcomes for your skin. In this video, we're going to take a deep dive into lasers, one of my favorite topics, and we'll discuss my favorite lasers in depth, and I'll teach you how to stack laser treatments to get that flawless glass skin look. I'm also going to set the record straight on some of the misinformation out there about lasers and tell you guys what to look out for when you're finding a laser provider. Stay until the end for a bonus segment where I'll tell you all the laser treatments I do on myself and my current laser stacking regimen. All right, let's get into it. Hi, my beauties. My name is Dr. Stephanie Capel, and I'm a board-certified, fellowship-trained cosmetic dermatologist. Laser treatments are incredibly powerful for skin rejuvenation, and different lasers used in combination have the ability to give you that perfect skin of your dreams. Many people are afraid of laser treatments or are overwhelmed with knowing what laser to choose from and who to go to. And it doesn't help that there is so much misinformation online regarding laser treatments. In this video, I want to empower you with knowledge about how lasers work and how to stack laser treatments to get amazingly youthful skin. I'll also discuss how to find a laser provider you can trust with your precious skin. To give you the best education on stacking lasers for glass skin, I'm going to split this video into 3 parts. First, we'll discuss the lasers I use in my office and how they work. Next, I'll teach you how you can stack laser treatments for perfect skin and what skin conditions these lasers can be used for. And lastly, you'll learn how to find a good laser provider. And I'll discuss some laser treatments I do not recommend. Starting off, let's talk about Fraxel. Fraxel Laser, also known as Fraxel Restore or Fraxel Dual, is one of my favorite lasers we have in my practice. Now, Fraxel Dual is called Fraxel Dual because it has 2 dual wavelengths. One is the 1927 nanometer handpiece, which addresses hyperpigmentation, brown spots, melasma, chloasma, sun damage. And the other handpiece is a 1550 nanometer handpiece, which addresses texture, pore size, fine lines, wrinkles, collagen stimulation, all the things. So the reason why I love the Fraxel Dual so much, which is also referred to as Fraxel Restore, is because it's very customizable. You can change the settings and make it very customizable for each individual patient depending on their skin needs. Most of the time people will have larger pores or texture regularities around on their chin, larger pores on the nose, larger pores on the medial cheeks, and then they'll have some texture or fine lines or wrinkles around the mouth or under the eyes, and then they'll have some brown spots on the sides of the face, on the forehead. So you can go into the settings and mix and match not only the wavelengths, but the settings, the number of passes, the fluence, the depth, and there's so much that you can do that makes it very customizable for each individual patient, which is why I love this laser. Now, you're not gonna see this laser on every street corner. You're not gonna see them in med spas because it requires a higher level of expertise to operate these devices. It's kind of like taking an Uber driver that's driving a regular car and putting him in a jet airplane and saying, okay, now drive this. And you're not going to find as many jet airplanes around as you're going to find regular everyday cars, just because simply it's harder to find someone who can operate this laser. But when you find somebody who understands these lasers and how to push them to the max with maximum safety and maximum results, there's nothing like it. You can't even compare. So I always encourage you guys to look for a laser specialist who understands these lasers, and don't just, go to any med spa where you're going to get your Botox and have them do your laser, because A, they're not going to have the best devices, and if they do, they're not going to have a laser operator who understands how to operate this machinery appropriately with best results and best outcomes. So you're not going to find a Fraxel Restore in med spas. You're not going to find them a dime a dozen. They're hard to find, because once you find one, it's going to be accompanied by a laser surgeon who really knows what he or she is doing. So just because they're not that common or popular doesn't mean that they're not good. As a matter of fact, the opposite is true. The really elite lasers that require an extra level of training and skill to operate are going to be few and far between. But when you find that device and you find a laser surgeon who understands how to work that device, those results are next level. Now, what's the difference between ablative and non-ablative lasers? Ablative lasers ablate tissue, and non-ablative lasers just heat them up. So what does that mean? When you're talking about a Fraxel, and Fraxel just means fractionated, and fractionated just means you're treating a fraction of the skin. When you look at the treatment area on the skin, when the laser handpiece is in contact with the skin, and it's just poking little holes into the skin and treating maybe 5%, 10%, 25%, 30% of the skin's area, you're not treating the whole entire surface of the skin. And what that translates to is a faster healing time. So when you have a fractionated laser, it's treating just a fraction of the skin. Now, fractionated can be ablative or non-ablative. And so I hope that makes sense, understanding the difference between ablative and non-ablative and fractionated and non-fractionated devices. Now, when you look at the cross-section of the skin, when it's treated with a laser, a non-ablative laser is just going to heat up that skin, those zones of thermal treatment into the skin. That skin's just going to be heated up, which is going to stimulate collagen synthesis, cellular renewal, and all the things that we want lasers to do to give us beautiful glass skin. An ablative laser is not just going to heat up that tissue, but it's going to poke thousands of tiny little holes in the skin by vaporizing and actually removing that tissue. And that's why you get pinpoint bleeding with an ablative laser. And with a non-ablative laser, you don't have that pinpoint bleeding, but you just look a little bit erythematous or a little bit red and a little bit swollen, almost like you just got out of a sauna or hot yoga. Versus ablative lasers, you kind of look like a vampire with pinpoint bleeding, it looks like microneedling afterwards with a little bit of bleeding, a little bit more aftercare that's involved in your post-laser recovery. Now let's talk about CO2 laser treatments. CO2 is an ablative laser. Ablative lasers, just like we said, is going to remove tissue. So that translates to a little bit more aggressive treatments, a little bit more discomfort during the treatment, and a little bit more downtime. So CO2 actually is an ablative laser, just like erbium. Erbium is another ablative laser that you may see when you're doing your searches online. Both of them are amazing. I actually happen to have a CO2, but I love erbium as well. And just because I have one laser and not another doesn't mean that I don't like the other laser. It's just when I did my fellowship training, I was in a 2-story laser institute with hundreds of lasers there. So I kind of could see which one gave better results and which ones I liked better, which ones patients liked better. And those are the ones that made the cut to be in my private practice. But I do love an erbium, even though I don't have one in my office, but I really love CO2 as well. But CO2 translates to more downtime, more discomfort during the procedure. For instance, instead of just using numbing cream, sometimes we have to use local anesthetic or even nerve blocks to make the patients comfortable during the treatment if we're doing a full face resurfacing. But what I tend to do, and what I find is really customizable and more more appropriate for my patients, is sometimes we'll do a non-ablative Fraxel laser treatment on the whole face in those areas that need a little bit more TLC, around the mouth for lip lines, under the eyes for fine lines and wrinkles. We'll hit the patient with the CO2 in those areas and do Fraxel everywhere else. Then you get a really customized approach and a really beautiful outcome, getting all of the treatments in the areas on the face that require certain things and achieving the goals that we're trying to achieve. So next, let's talk about Vbeam Laser. I actually just had Vbeam Laser and I'm a little swollen. I don't know if you guys could tell, I have chubby swollen cheeks. I had a Vbeam Laser on Monday and today is Saturday, so it's been about 5 or 6 days. And Vbeam Laser just stands for vascular. V is for vascular, and it's a vascular laser that is used to treat redness, facial vessels, telangiectasias, rosacea, facial flushing, any redness in acne scars, redness in any type of scars, and also discoloration under the eyes, like the under eye bags that kind of have that blue-purple hue under the eyes. It's great with brightening up the under eyes. It's one of my favorite treatments. Usually you need 3 treatments spaced about 1 month apart. But vascular lasers, or Vbeam, is a really great laser for treating redness, but also is a great rejuvenating laser, and one that I've been doing on myself since my early 20s. And I'm in my my late 40s now. Oh my gosh. So now that I've been doing it, at least once or twice a year for almost half of my life, I think that it really has made a big difference in my skin. And just from a histological perspective, retracting those blood vessels back just gives that porcelain looking skin. It takes out that ruddiness or that weather beaten or that sun damaged skin look and gives it a really revitalized, bright, fresh look. It also can help with texture of the skin. I also, I recently recertified my board examination. I don't know if you guys know this, but board certified dermatologists have to renew their boards and take quarterly exams and read up on the literature, and we get tested on all these different topics that are new in dermatology, and Vbeam was one of the topics, and it was explaining how Vbeam laser has been shown to improve texture. I could have told you that 20 years ago because my skin always looked amazing after doing Vbeam, not for redness, but just for overall rejuvenation. So Vbeam is a really underrated laser, one that I use in my office a lot, including on myself. It does cause a little bit of redness and swelling that lasts about 4 to 6 days. Some people swell more, like myself, than others, and some people get a little bit more red than others. I typically don't get red, but I typically do get swollen. But swelling swelling isn't a bad thing, you guys. Swelling means that there's increased signal transduction pathways and cascades being set off in the skin to stimulate collagen, elastin, and all those rejuvenating effects that we want to have in the skin. So Clear and Brilliant Laser. Clear and Brilliant is like a baby Fraxel, and it's a baby Fraxel treatment that is great for people who want no downtime and no discomfort at all during the procedure. Now, I've seen reviews online where people will say Clear and Brilliant is painful. It should never be painful. And if it is painful, you're usually getting this done at maybe a med spa or a non-medical clinic that can't give you strong enough numbing cream, because with appropriate numbing cream, you should even feel it at all. And the downtime is negligible. You can go out to lunch with your friends after the treatment. No one will know that you had anything done. And so I really like Clear and Brilliant because it's a great option for my patients who have little to no downtime and don't want any discomfort, or if it's a patient's first time experiencing a laser treatment. And I always say about 4 Clear and Brilliants equal 1 Fraxel Restore, because it is a baby treatment that requires multiple treatments to kind of make up for the fact that it's not as strong. It's like when you go to the gym and you pull the lighter weights and you do more reps, as opposed to the heavier weights where you just do less reps because they're heavier weights. So I always think of it in those terms. And on a level of continuum, you have your Fraxel Restore, which is non-ablative. The more aggressive one is Fraxel Repair, and the less aggressive would be a Clear and Brilliant. But Clear and Brilliant addresses both the texture and tone of the skin just like a Fraxel Restore does, but it does it on a lesser, more superficial treatment basis, which means you have less pain and less downtime. The 1927 nanometer handpiece addresses hyperpigmentation, and the 1440, not a 1450 like a Fraxel Restore, but the 1440 addresses collagen stimulation, pore size, texture, fine lines, wrinkles, and all the things. So I really love Clear and Brilliant. I typically do a Clear and Brilliant every once in a while, especially if I have an event to go to and I want a little glow up. It's great for my brides who are about to get married to have a little glow up before their wedding or a birthday or a trip or a vacation. It's one of my favorite lasers, and it's really amazing that there's no pain or no downtime, and it makes the skin glow. Popping in real quick to tell you something really exciting that I'm incorporating into my content routine. You guys always have such great questions in the comment section, but I can't always get back to all of you. My team and I decided to implement something new called Ask the Doc, where I answer questions from my social media posts and email the answers to you. If you want to get answers to commonly asked questions, be sure to click the link below and sign up for the Ask the Doc email. Ask your questions in the comments with hashtag #AskTheDoc to be sure to get your questions answered. So let's talk about the Pico laser. So Pico laser is called Pico because it fires at a picosecond, which is a trillionth of a second. Now, not to sound too nerdy or scientific, but a picosecond is so fast that there's a photoacoustic, not a photothermal reaction. And what does that mean in English? When the photons of the laser hit the melanin, which is the pigment, whether that's pigment in a brown spot or melasma or dyspigmentation of the skin, to even out the tone or the texture or the color of the skin, the Pico laser will target that melanin, shatter it with no dissipation of heat, and that translates to no hyperpigmentation from the laser. So it's great for my olive skin tones, my Fitzpatrick skin types 3 through 6, Asian skin, Hispanic skin, and skin of color with beautiful olive skin tones without that risk of hyperpigmentation, which makes it really, really nice. So the picosecond, because of the mechanism in which it works, makes it safer for dark skin tones. But it's important to note that, as with anything, when we're talking about the Pico laser or lasers that are used for skin of color or darker skin tones, it all is laser operator dependent, you guys. I've seen people on YouTube say you cannot treat darker skin tones with lasers. That's false. You can't treat melasma with lasers. That's false. These are people who don't have the education, and it's very obvious they don't have the education to me when I hear them say that. But for a viewer or a subscriber trying to learn about lasers and how lasers work, it's going to give you misinformation. But the true answer is, yes, lasers are safe for darker skin tones. Not all of them. You have to know the correct laser settings. You have to know how to pre and post manage the skin with topicals. You have to know the correct laser settings to use. And just because one person doesn't know how to use lasers, or who had bad luck with lasers or caused complications with lasers, doesn't mean that they can make a blanket statement saying, oh, lasers aren't safe for darker skin tones. For them it might be, and for you as a patient, you're not going to want to go to the guy that's saying that. You want to go to the laser provider who can safely and effectively deliver outcomes with lasers as appropriately. And so I feel like that's the biggest misconception on YouTube. And I've actually had patients in my office come to see me who have gone 10, 12, 15 years without treating their melasma because they were told by a provider, or they saw somebody on YouTube saying that lasers aren't safe for treatment of melasma. Well, for those doctors, it's not safe. But if you go to a laser specialist, it can be very safe and effective. You just have to do your research. You have to go to someone highly educated and well-versed in lasers. And the sad thing is that most of these people don't have laser fellowship training where you get thousands and thousands and thousands of cases and hours of education on how to operate these lasers. Lasers are very finicky, very elegant, very powerful devices. But with great power comes great responsibility. You have to know what you're doing. You have to understand laser physics, the mechanisms, the theory of selective photothermolysis. You have to know all of these things. And if you don't, you can't just say, oh, lasers aren't an option for you, just because that person doesn't know how to do it. So it's really important to cite your source, who are making these statements, especially on YouTube, because people who are making YouTube videos are usually not the people in clinics, in busy clinics, treating patients every day. I know I'm doing both. I'm trying to do these YouTube videos for you guys once a week, but I'm also seeing 20 to 30 patients in my office every day, doing laser treatments on my patients every day, and I try to make time to make these YouTube videos for you, for education, to empower you guys with knowledge, because I know that most of the knowledge out there on YouTube is coming from doctors who are not even seeing patients and don't even know how to use these devices. They're just too busy making YouTube videos and getting paid partnerships and sponsorships from companies and pharma and these bigger companies, which is what pays their bills, not seeing patients. So it's really important to keep that in mind. What skin conditions can lasers be used for? The reason why we talk about lasers creating glass skin or perfect skin or healthy skin is because lasers actually treat the cause of the imperfection, whether it's a brown spot, whether it's a redness or a broken capillary, an acne scar, dilated pores, wrinkles. It actually helps on a histological level, on a cellular level, correct the imperfection. So instead of masking it or putting a bunch of makeup on something, ablating the problem and targeting the problem from on a cellular level from within the skin manifests with beautiful skin. I wish I could show you guys what my skin would look like if I didn't do Vbeam for rosacea, if I didn't do Clear and Brilliant for my melasma, if I didn't do Pico for my melasma, if I didn't CO2 under my eyes, if I didn't do CO2 around my mouth. So I feel like lasers really inherently correct the skin from within, and it stimulates your skin cells to act and behave in the most healthy manner, and it targets and treats the blemishes on a cellular level. And that's why lasers are the best. And of course I'm biased because I'm a laser specialist, but I also have taken years of my life in education and training in school to understand how these lasers work and how to operate them. Now, when you hear about BBL or IPL, BBL just stands for broadband light, IPL just stands for intense pulse light. These are kind of jack of all trades, master of none. My colleagues and I always joke around and say, you might as well put a flashlight up against your face, because there's no coherent wavelength. It's not truly a laser. These are just broadband light treatments that you put a filter on and they kind of act like a laser, but they're not technically a true laser. They're not elegant, they're not targeted, and they often make things worse. So I've seen a lot of patients who have had melasma become worse from treatments with IPL and BBL at different medi-spas, and it's just a shame, because if they would have had appropriate treatment with a Pico or a Clear and Brilliant and skin conditioning, it would have been a lot better and saved them a lot of money and heartache and discomfort. Continuing skin conditions that lasers can be used for: melasma, acne scars, rosacea, fine lines and wrinkles. There's so many different things, and there's different lasers that specifically target each individual skin ailment. So the laser that you're going to use for redness may not be the same laser that you're going to use to improve the texture of an acne scar, or the same laser that you're going to use to remove a brown spot. So combining and stacking these lasers, not only all together, but in certain areas of the face where they're needed, gives the most beautiful and most natural outcomes that are long lasting. Why choose lasers over other treatment options? And the reason is because lasers correct on a cellular level the skin ailment. It doesn't put a band-aid over it, it actually corrects it. If you look at melasma under the microscope and you look at pre and post laser treatment, the pigmentation, the melanin particles are gone, and the texture and the improvement in the pigmentation is seen on a histological slide when you're looking at skin under the microscope. And I spent decades looking at skin under the microscope, and I found this highly fascinating. So lasers will get rid of the root of the problem. Now, we always say we can't change genes, we could just fix the skin. So if you're, for example, Irish, English, Scottish heritage, and you're prone to redness or broken capillaries or broken vessels on the face, and you have a Vbeam treatment, you'll have results that last for a couple years, but your body's going to maybe make those new vessels again, and you'll have to do a maintenance treatment 2 to 3 years later to keep the skin at bay. But it's much easier to maintain once you get your skin where you want it to be than getting from point A to point B and correcting all these things. Another thing is lasers, and as a skin cancer Mohs surgeon, I really am appreciative of the fact that lasers are kind of out with the old, in with the new. When you look at sun-damaged skin under the microscope, you see disfragmented collagen fibers, disfragmented elastin fibers, and that correlates with clinical skin that's dull, lustreless, the pores are stretched out, acne scars as you get older get more stretched out, the skin gets thinner, the laxity increases, you have fine lines and wrinkles. When you look at skin under the microscope after a laser, you have chock full of thick, pink, healthy collagen, you have healthy elastin fibers, and all the recruitment of those inflammatory cells to get rid of that degraded, dysfunctional extracellular matrix proteins like the collagen and elastin that are making you look old is gone, and it's replacing it with fresh, healthy extracellular matrix proteins like collagen and elastin. Healthy cells, healthy cellular activity. Lasers are like a workout for your skin that are going to fix your skin from within on a cellular level, and there's nothing that can compete with that. Skincare actives can help, and they make a big difference in the skin, but other treatments are not going to have that same effect that lasers can achieve for your skin on a cellular level. And when you combine skincare products with lasers and using photoprotection, there's nothing else like it. So skincare products, for example, my line that I engineered myself, MD Air, I was passionate about this because, well, first of all, most of the medical grade skincare companies that I really, really loved got bought out by bigger companies, and then they changed their formulations, and I can't trust what's in those products to give to my precious patients who, and my loved ones who I want to only give them the best and the best technology, best vehicle delivery systems, best active ingredients. But when you combine skincare and sunscreen and photoprotection with lasers, and you get in the habit of doing maybe a couple, 1-2 lasers a year, long term, those are the patients that have the best, healthiest looking skin, and the skin that has a decreased risk of skin cancer and pre-cancer. How to get glass skin with lasers. So the way to get glass skin, now the term glass skin, porcelain skin, flawless skin, filtered skin is less pore size, decreased pore size. You're never going to get rid of the pores because those are associated with the pilosebaceous unit and they're functional in the skin. You need pores. Everybody has pores, even though some are barely discernible because they're so tiny. But that poreless skin look, decreased vessels that are giving the skin that underlying ruddy, kind of weathered looking appearance, evening out the hyperpigmentation so you don't have patches of melanin irregularly distributed through the skin, which is going to age us and make us look old. That glass skin happens when you decrease the redness, decrease the vessels that are a result of sun damage or actinic damage or photo damage, decreasing the pore size, stimulating healthy collagen and elastin to give skin that plump, beautiful glow. And that's what gives skin that glass skin look. That's the skin that everyone is trying to achieve. And sometimes it involves stacking of different lasers, a Vbeam for the redness, a Pico or a Clear and Brilliant 1927 handpiece for the pigmentation, and then a Fraxel over everything else to just make everything look better, stimulating collagen, shrinking pore size, all the things. So each individual patient that I see in my office, and for you guys who live far away, I'm in Orange County, I encourage you guys to look for laser specialists in your area. And I will give you the tools and keys to look for a laser specialist that you can trust, because it's really, really important, because you're not going to get these results if you're not going to somebody who knows what they're doing or who's choosing the inappropriate settings or laser choice based on your skin type and what you're trying to correct and how you're trying to get that glass skin. The skin tightening laser treatments. Now, lasers aren't tightening devices. Tightening devices are usually energy-based devices. They put heat in the form of energy into the skin, whereas lasers are collimated light in a coherent wavelength and photons. So I know that probably just sounded really scientific and scary, but energy-based devices like Thermage, Ultherapy, Softwave, Thermatite, those are energy-based tightening devices. They don't do anything for the surface of the skin. It's not going to do anything for brown spots or pigmentation or sunspots or things on the surface of the skin. They just tighten underneath, and they're amazing devices when operated correctly. Oh, that's a whole nother video for another time. But lasers, which are photons and light-based devices, not energy-based devices, don't do so much for tightening. They smooth the superficial texture of the skin, but lasers are more superficial. They don't go deeper. So it's not, I don't usually call lasers tightening devices, although they can smooth the surface of the skin and kind of smooth out etched in lines, fine lines, and wrinkles. But for tightening, I usually recommend energy-based devices. For resurfacing fine lines and wrinkles on the surface of the skin, not tightening per se, I usually recommend lasers. So when patients come in saying, Dr. Cabell, I want this, can I have a laser that does this? Lasers don't do this. Lasers smooth the texture of the skin, but they don't lift and tighten like energy-based devices do, like Thermage does. Laser treatment for acne scars. Now, acne scars can have different morphological features. They could be red, they could be hyperpigmented, they could be textured like boxcar or ice pick scars. Usually textured scars respond best to resurfacing lasers. So Halo, Fraxel, CO2, Vbeam, Palomar, M22, those are going to be lasers that are going to improve the texture of the scars. Now, if the scars have a red component to them, Vbeam would be the answer. Or if they have texture and redness, which many of them do, we do a combination and laser stack those different treatments. If there's hyperpigmented acne scars, we usually will go with a Clear and Brilliant 1927 nanometer handpiece or the Pico, or you can also use the YAG laser. So depending on the morphological features of the acne scar, governs the type of laser or combination of laser treatments required to make it look better. Now, with regardless the different treatments or lasers we choose for acne scars, typically multiple treatments are used, ideally spaced 1 month apart. And so we'll usually recommend 3 treatments spaced 1 month apart, see how the acne scars are looking, and sometimes we can intervene with other treatments like subcision or a filler or microneedling or microcoring. I'm not a huge microneedling fan because I always think that the results are very suboptimal. Microcoring or other treatment modalities to help make the acne scars look better. But typically, for all intents and purposes, laser treatments are usually needed in multiples, usually 3 treatment sessions spaced 1 month apart. Melasma treatment. Now, this is a topic that is very frustrating when I look on YouTube and I see people saying that laser treatments aren't useful for melasma. And if you want to refer to my previous video, I did a whole video on lasers for melasma. Now, there's a lot of doctors on YouTube saying that you can't use lasers for melasma. And the frustrating thing is that some of the biggest YouTubers who are physicians aren't seeing patients every day in a clinic, and they're usually not well versed in lasers. And because they think that it's not achievable to get a good outcome from a laser treatment for melasma, then they think that if they can't do it, that it's just not an option or an option for anyone, which is completely untrue. In my whole laser fellowship training, I learned to treat skin of color, olive skin tones. We treated melasma, and we did it with great success and a very, very safe effects, because you have to understand how the skin's going to respond, how to adjust the laser settings, and how to pre and post condition the skin. And when you do that, you get beautiful, safe results for all of your patients. And so it's very misleading to say that lasers can't be used to treat melasma, because that is just not true. Just because that person doesn't know how to safely treat melasma with lasers doesn't mean that it's not an option, and that's the important thing to remember. So Fraxel Laser for hyperpigmentation. Fraxel Laser for hyperpigmentation can work, but Fraxel does have an increased propensity to cause hyperpigmentation. So if you're going to use a Fraxel dual, you could use the 1927 nanometer handpiece part of that laser, but if I'm going to treat hyperpigmentation, Pico and Clear and Brilliant 1927 are my go-to. Clear and Brilliant was engineered to treat melasma safely in skin types 3 through 6. I was there for the clinical trials. I have a lot of experience with this laser, and anybody who tells you differently is just not educated enough in this space to be opinionated on it. Pico Laser for hyperpigmentation. We touched on Pico Laser earlier. Pico laser is a picosecond, a trillionth of a second, very fast laser, very high performance laser. It's a photoacoustic, not a photothermal reaction, which translates to treating hyperpigmentation without the risk of post-inflammatory hyperpigmentation. So you don't want to treat a brown spot and then get brown from the laser itself in the first place. And that's why Pico is a very elegant option for safely treating brown spots or hyperpigmentation, especially in olive skin tones. CO2 laser treatment for acne scars. CO2 is one of my favorite treatment options for acne scars, in addition to a non-ablative Fraxel resurfacing laser. And again, as I stated earlier, usually 3 treatments are needed, spaced about 1 month apart. There's a little bit of more downtime associated with the CO2. It's going to be a little bit red and swollen for weeks, sometimes even months after the treatment, but it will help remodel the scars and will help with scar revision for beautiful, smooth skin and improvement of the textural regularities associated with acne scars. Laser misinformation and laser misconceptions. So I touched on this earlier, but it's really important to understand that most of the physicians on YouTube are not seeing patients every day in a clinic. Now, I'm the crazy person trying to balance getting a YouTube video out each week, but where that comes from is my passion to educate and empower you guys, because there's so much misinformation online, especially on YouTube, by physicians who are in paid partnerships with either laser companies or pharma or bigger companies in the industry. They're in contract to say certain things about certain devices and not say certain things about other devices. And it artificially gives this credibility to a physician that shouldn't probably have that credibility, because they're not as highly trained or educated in this space. Aesthetics is a very lucrative industry, and a lot of people want to cross over into this specialty and be on YouTube as these aesthetics experts. But if you actually go to these physicians' websites and you look at their credentials, look where they did their residency training. Look what they did their residency in. It's usually family practice, pediatrics, OBGYN, not aesthetics. We're a very small family of doctors, a few and far between, and it's really hard to find an expert who is really speaking truly on these topics. So a misinformation and misconception that gets perpetuated on YouTube is that lasers can't be used to treat skin of color, which is completely untrue. Safely and effectively, it's hard to do. And don't get me wrong, you need very specific settings. You need to have the right laser, and you have to be well versed and very experienced with this skin type and using the lasers, but it can be done. You just have to find the right laser surgeon to be able to provide this treatment for you. And another misconception is I've seen lasers can't be used to treat melasma, which is completely untrue. Just because that doctor doesn't know how to do it doesn't mean that it's not attainable. And it just comes back and down to really trusting who you're following on YouTube and making sure that that doctor is not sponsored or in paid partnerships, because it's just an increasing problem. And even some of my friends and colleagues who I trained with are no longer seeing patients anymore, because they're getting so much money from pharma and these bigger companies and these paid partnerships that they're just making YouTube videos. They don't even have clinics anymore. They're not even seeing patients anymore. So it really bums me out and it makes me sad, but it also fuels me to do these videos as a non-sponsored doctor to provide you guys with information and the tools to empower you so that you don't get taken advantage of and you don't get misinformed. Do lasers cause fat loss? This is also a misconception. You have to remember, you guys, when you're looking for information online, I want you guys to think like scientists. When you're looking at skin on cross-section, you have the epidermis, then you have the papillary dermis, then you have the reticular dermis, then you have the subcuticular fat. That subcutaneous fat is way down here. Lasers are way up here. They're not even in the same tissue plane to cause any loss of fat. And so when you see people saying lasers cause fat loss, A, they're uneducated, B, that is not correct, and C, it's probably coming from a person who doesn't own a laser or have a laser in their practice. So it's really important to cite your source and know where you're getting this information from, and just see what their angle is or where they're coming from. People may ask, well, Dr. Capel, what's your angle? Why are you on here? You're not sponsored. You're not making money on YouTube. I really, truly feel that it's my passion to provide a source of truth and honesty and information, because I see how corrupt this industry is becoming. And being old school and being in this industry for almost 20 years now, it's just kind of my mission in life, just to educate you guys and be a source of reason and honesty on YouTube in a world that's corrupted with people who are not specialists in this area, or they don't have lasers themselves, which are why they're trying to promote treatments or products that they do have. Lasers I don't recommend. These aren't technically lasers, but BBL, which stands for broadband light, and IPL, which stands for intense pulse light, are not truly lasers. We always say that these are fake lasers or just lights, or you might as well put a flashlight on your face. It's broadband light that you're putting a filter on to make it act like a laser, but it lacks the elegance and the technology of a true laser. And laser by definition is light amplification by the stimulation of the emission of radiation, and those are photons in a coherent wavelength that is attracted to a certain particular chromophore. And that's the way lasers work. So broadband light, I feel, always causes more harm than good, and I usually see a lot of patients who have been treated with IPL or BBL who get less than desirable outcomes, usually hyperpigmentation, worsening of melasma, and different side effects without really much improvement that have long-lasting results. Laser caution, so thing to be worried about, and again, as a laser specialist, I see complications that go on the outside all the time, and they get referred to me to correct when people have complications, scarring, less desirable outcomes, and they come to me, Dr. Capel, to fix it. I want to tell you a story. So just this last week, just 2 days ago, I saw this patient who flew in to see me. She had horrific scarring on both of her cheeks after a CO2 laser was done by a plastic surgeon in Vegas. Plastic surgeons spend 6 to 8 years in the OR, in surgery, operating. They don't really have lasers in their residency training as dermatologists do. And dermatologists sometimes don't also get lasers in their didactics or in their program training because it depends on where you go. If you're in the Midwest, you're not going to get as much laser exposure as if you will at UCLA, where I attended in the middle of West LA, which is like the epicenter of cosmetic dermatology, or for example, Miami or New York. So it just really depends on where you train. But the thing to know is that, for example, this patient that came in, she was a beautiful girl, and 2 years ago she had CO2 resurfacing on her face, and it caused her with permanent scarring of her mid-face. She came into my office, she came in to see me in tears and said that the plastic surgeon that had treated her 2 years ago scarred her with horrific scarring when she had beautiful skin to begin with and was just doing it for more prevention or rejuvenation, and scarred her. And when she came back to the plastic surgeon, he shooed her away from the office. He told her she had mental instability issues. He told her that she was histrionic, narcissistic, and that their redness was not from laser, but was from rosacea and from something else that was going on in her skin. So this is really devastating to me when I hear about this happening. And the problem is that sometimes plastic surgeons will want to include a service that the patient requests, even if it's something that's out of their wheelhouse, not in their scope of practice. They usually don't have the laser. They'll rent the laser for the day for that particular patient. You rent it for $500. You charge the patient $5,000. You permanently scar them, and then you shoo them away from the office. And I see that all too often. It's not like I've seen a handful of these. I see them very regularly in my office, and we can do lasers and treatments to kind of reverse it. But if I can empower you guys, just be really, really careful. That's not to say that all plastic surgeons don't know lasers. Most of them do, I'm sure, if they're providing those treatments. But something to look for is you can ask your plastic surgeon, do you own this laser, or you just rent it every once in a while when a patient asks to have this service done? Because somebody who's renting a laser for a day is not going to know the ins and outs of that machine. It's someone who owns it, who operates it, who uses it every day. And so this is where I see the most scarring and horrific outcomes happening. So if I can teach you guys anything, be sure, if you're going to get a laser resurfacing, especially like a CO2 or a really ablative, high, aggressive laser, I wouldn't do it under general anesthesia with a plastic surgeon. I would find a laser specialist, usually would be board certified in dermatology, to provide this treatment option. Another thing is that most dermatologists do things under local or topical anesthesia. If you're intubated and on a ventilator on general anesthesia and somebody's blasting you with a laser, that's a recipe for disaster. The patient isn't awake enough to say, hey, turn that down, like that's hurting, and as a dermatologist, even when people are having, anxiolytics or they have nerve blocks, they'll say, okay, that's like a little too much. And that feedback, that biofeedback from the patient is very, very important. I don't think it's a good idea ever to have a laser under general anesthesia. And if I could recommend anything, it would be to stay away from that situation, especially with someone who doesn't own the laser and they're just like renting it from a day. So maybe ask your provider, do you own this laser? Did you just rent it for the day? How many times have you used this? Let me see your before and afters. How long have you been doing this? You should probably even quiz them on the wavelengths and settings and ask them for the settings ahead of time if you really want to throw them for a loop. But knowledge is power, and I'm on your side, you guys. I want you to be empowered and not have these bad things happen to you. And on that note, how to find a laser provider you can trust. Now, I've done videos on this in the past, but my best advice to you guys is to find someone who has been doing this for a long time. Their level of experience and training, how long they've been using lasers, how they select what lasers to have in their office, and more importantly, if they are members of certain societies like the ASDS, which is American Society for Dermatologic Surgery, ASLMS, ASLMS, which is American Society for Laser Medicine and Surgery. When laser specialists are going to these meetings, staying updated in laser medicine, it really makes a difference, as opposed to like maybe a medi-spa where there's one laser that they have and a bunch of extenders that don't really know what they're doing, operating this and doing the same thing on everyone. You don't want that. You want someone who is passionate about this field, who understands laser medicine, who is keeping up to date with their continuous medical education in lasers. And what you can look for on someone's website is where they did their residency training. And if they did advanced fellowship training in lasers, that's like the best thing to look for. Now, I know I have that and other my colleagues have that, and we're few and far between, but that's not actually necessary. That's a little overkill. But at least look for someone who attends these meetings and stays up to date. And even more importantly, if you can find a doctor who's at the podium and lecturing and educating other doctors and providers on how to use lasers, that's something that's really important to look for too. Doctors or other providers who are affiliated with academic centers, like do they teach at UCLA, or are they on faculty for academic centers in their area? Those are the people that you want to go to and who you should trust with lasers. So with anything, it comes with experience, level of training, years of training, and if they're an expert in the field. And you can kind of sift through and find the true experts, because we're the ones going to these academic meetings and we're the ones at the podiums and lecturing and educating others. So it's your face, you guys. You don't want to have a complication or a less than desirable outcome, and those are the things to look for. And if you want to learn a little bit more on how to find a laser specialist, watch my other videos on how to find an aesthetic provider. And the other thing is that don't be hung up on whether they're an MD or an RN or a PA or an extender. Everyone is just basically based on their level of training, and that could be an MD, a nurse provider. Even in my office, one of the most highly trained individuals I know is actually an RN, and she went through training with me when I was a fellow. And this is an RN who has 12 years of intense laser experience, who I would trust more so than most doctors out there. So don't get hung up on it being an MD. If you're seeing a nurse provider or an NP, don't get hung up on it having to be an MD, because half the time physicians, although they have medical degrees, don't have any experience in lasers. So just trust your judgment, do your research, look into people's credentials, where they've gone to school, what society memberships they have, where they get their continuous medical education and their education in lasers. And if someone is really active in education, whether they're teaching it or they're attending courses to learn about it more, that's really, really important, and that's what you want to look for. And a lot of times patients will tell me, well, I went to a plastic surgeon's office and I was treated by an extender. That's not necessarily a bad thing. Sometimes the extenders know more than the actual physician does, especially if it's a plastic surgeon. No offense to plastic surgeons, but an extender who has gone through laser training and extensive training in laser medicine isn't necessarily worse. Sometimes it's even better than having an MD who has no experience in lasers, but is just heading the medi-spa or the clinic or the office. So as with anything, don't get hung up on people's degrees. Just look at their level of training and education in laser medicine and their years of experience, because that correlates with the safest and most desirable outcomes. Hi, MayBeauties. So I realized at the end of my video, I didn't include laser treatments that I do on myself. So I've been doing lasers on myself for about 15 years or so. I'm in my late 40s now, but I started in my early 20s because I had early access as a dermatology resident. But I've been a firm believer of lasers, and right now that I'm in my late 40s, I usually do about one laser Fraxel resurfacing treatment over my entire face, my neck, and my chest. I usually do one Vbeam treatment over my entire face. And about 2 or 3 times a year, I'll do a light resurfacing laser, or sometimes I'll do a CO2 laser underneath my eyes, because that's the area that needs the most TLC. It's the thinnest skin on our face. It's the first to show our age. So we want to keep the collagen and elastin stores in that under eye area nice and smooth and tight over time. And other laser treatments that I do include a clear and brilliant every once in a while. I'll probably do a clear and brilliant about once a quarter, every 3 months or so. And then if I have an event to go to, or a birthday party, or we're going on vacation or somewhere special, I do a clear and brilliant to just kind of rejuvenate my face and to give a brightening effect. So my go-tos are laser resurfacing with Fraxel, CO2 for under the eyes, Vbeam, and clear and brilliant when I need a little boost. And then as far as energy-based device treatments, I usually do a thermage, which is not a laser, but I do that every 5 years, and I have since my early 30s. So I hope this helps you guys. Wanted to give away my secrets, and it's pretty much all about lasers. All right, you guys, I hope you enjoyed this video. Drop a comment in the comment section and let me know what you think and what you want to hear about next week. Thank you so much for watching, and I'd appreciate it if you could share this channel with anyone else who would want non-sponsored content from a board-certified dermatologist. All right, you guys, I love you. Thank you so much.